The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health education purposes only and complies with all HIPAA regulations. All of the CDC guidelines for COVID-19 safety were followed while filming this episode of the Dr. Fazil Show.
Hello audience, I'm Dr. Fazil. You're watching Dr. Fazil's TV show, and this is the episode for October 2022. Welcome. The topic for today's discussion is how much water we should drink. As a very common question, I have been asked multiple times in my practice how much we should drink. I remember I'm also a kidney specialist as well as internal medical specialist, so that question I can answer very well since I am qualified in both specialties, which deals with fluid and electrolyte balance in the body. So remember, the how much water we drink depends on a lot of factors. It depends on where you live, what is the temperature of the area where you live in. If it's hot and humid, you will have to drink more water. So there's not a single answer to this question. It's an important question, but answer is not as simple as people think. So in general, they say 1 to 1.5 liters is the minimum requirement. But again, it depends on a lot of other medical conditions as well. For example, if you have heart failure, so your heart is weak, it's not pumping enough fluid, it is going to back up into the lungs and in the legs, then obviously you have to even cut on even less fluid than 1.5 liters a day. So also it depends on other medical conditions. For example, if you have liver failure or if you have kidney failure, then your fluid restriction has to be even more. So the question is how much fluid you should drink depends on at least two factors. One is how much are you losing fluids every day, and that could change from day to day. For example, if you have diarrhea, nausea, vomiting, or not able to drink enough fluid, or if you're vomiting fluid and if you are losing fluid through that diarrhea, then obviously you have to drink more water than the general principle of 1.5 liter. If you are in a desert situation like Arizona or states like that, or environment like that, and depending also on what month of the year is, your evaporation. Remember, we also lose a lot of fluids without knowingly, known as insensible perspiration or sweating, which is another form of loss of fluid through the skin. So we lose water through vomiting, diarrhea, through sweating and insensible loss of water through the skin through evaporation process to keep our temperature under control. So we have to keep those things in mind. So based on that, either we have to increase the fluid intake or decrease the fluid intake. Generally, if you feel we have receptors in our body known as osmotic receptors in the blood and in the brain, and if we need to drink more water, generally our blood will become more concentrated, and those receptors will give signals to our brain to drink more fluid, and we automatically will drink fluid. In certain situations, even that might be happening. A person can still become dehydrated. For example, if you are, stuck somewhere there's a lack of water, like in desert, or for example, bedridden patients which are not able to communicate, or for example, nursing home patients, they can get dehydrated if they are not taken care of. So that can cause dehydration as well, because even though their body is telling them to drink fluids, they cannot communicate, or they're not being able to walk to get the water, and that can cause also dehydration. So those are other factors which can cause dehydration. Even the body is trying to tell a person that they need to drink more fluids. So both less fluid and more fluid is also critical, because less fluid can cause dehydration, and that can cause a lot of kidney failure and a lot of other downstream effects. But drinking too much water also cause, we call it water intoxication, and sometimes people drink it habitually, and we call it psychogenic polydipsia, and it is also bad, because if you drink a lot of fluid kidneys have certain capabilities of holding fluid to a certain extent. After that extent, you can lose all the electrolytes, and that can cause, low potassium or sodium in the body, which by itself can cause neurological problems in the body. So we have to be careful. So generally, I tell the patient to drink when the body tells you to drink, and don't drink if you have swelling in the leg. If your legs are swollen, that means you already have fluid more than what you need. So then you have to reduce water intake. At that time, not only we do the fluid restrictions. When we say fluid, it includes everything. It includes coffee, juice, water, ice. Ice also becomes water. Remember that ice is also should be included in the total. When we look at the quantity of the fluid, then water is also part of it. So now we have to worry about the answer to the question, like how much we drink. Again, the golden answer is, the magic answer is 1.5 liters.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
But then there's a caveat, there's exceptions. Again, if your legs are swollen, short of breath, don't drink too much water, cut down even less. And then if you're taking water pill, they would not work, because if you're drinking more water and taking water pill at the same time, you're just flushing the water through your kidneys. So if you're already on fluid restriction, that includes taking water pills. Look at your legs, and if they're swollen, we call it pitting edema. You can see in the picture behind me, this is known as pitting edema. So if you're pressed hard on your ankles where the bone is, as you can make a dimple, you're replacing the fluid on the sides. That is causing pitting, and we call it pitting edema. So, and we can quantify +1, +2, +3, but that is for mostly for medical personnel. So if you have edema already, then just don't drink fluid. And there's a right way to check it. I mean, sometimes I have seen people slightly touch the skin to see if they have edema. You have to push really hard in front of the bone of the leg, we call it tibia. And this is a picture behind me, it says tibia. And you can see we have to push real hard for a few minutes, for at least 30 seconds. And it will actually, that pressure will cause displacement of fluid on the side and will cause dimple. Now, if you have dimple, that means you have too much water, and that's why it is retaining in the legs due to gravity. If we keep drinking fluid, it will build up to the lungs and will cause heart failure and congestion and shortness of breath. So automatically reduce water intake. The other way, fancy way, would be wear yourself every day with the same kind of clothes or same kind of machine. And if you're gaining weight rapidly, for let's say your gaining weight is 2 pounds, 3 pounds every day, then you're retaining fluid. That's more scientific way of finding out if you're retaining fluid. So looking at your legs and also weighing yourself daily can help you to see if you're retaining fluid. It's important for patients which have heart problem, kidney problem, or liver problem. So those are the conditions or exceptions that change from day to day how much fluid they can drink. Generally, I see when the patients come from the hospital, they are swollen. And the reason is, like, mostly when patients get admitted in the hospital, they drink enough fluid, they are given generally IV fluids. And when they're laying down, all the fluid goes to their back, and like we call it sacral edema, which cannot be seen unless you turn the patient on the side and look for it. obviously that get missed easily. When they get discharged, since the trip is ongoing for days and days and days, sometimes, not all the time, but sometimes, or most of the time, when they get discharged, when they start standing on the legs, all that fluid gravitate towards the legs, and now the legs are swollen. So when the patient goes to the primary care doctor, they're confused, like, yeah, there's more water in the legs than it was like a few days ago, because they are on their feet, they're standing up. The fluid is coming from their back into the front of the legs, and at that time they have to cut down on the water intake to reduce edema or swelling in the legs. So that's a common phenomena. We see it all the time when patients get discharged from the hospital or certain kind of or facilities where they get a lot of IV fluids over days and days. It gets easily masked by in their backs because they're laying flat on their bed for most of the time. So that's another point we have to keep in mind. And when we decide when to take water, when not to take water, how much you need to take fluids. Again, when I say water, it means all the fluids. That means all the liquids. That could be anything. But so again, I don't want to make it more complicated than it need to be. If you don't have any medical condition, if you're in a good health, if you're living in a normal environment which is not too much heat, like mostly indoor or partially outdoor and indoor, 1.5 liters is the minimum. You can drink more. Kidney can, if you have no kidney problem, kidney can handle it. Excess fluid can be flushed out to the urination. If you need more, again, your body will tell you you feel thirsty, and you will drink water or any other kind of fluids. And when your osmolality or concentration of the blood become normal, your body will stop that urge. Then when automatically person subconsciously they stop drinking fluids. So that's for a normal person under normal environment. Now if you're working outside, sometimes we see that people forget to drink fluids, and they do not realize how much water they are losing through sweating and perspiration. At that time you have to be a little bit more careful, and that's how we see patients with dehydration. When they pass out, the blood pressure drops, especially if they are taking water pills and taking blood pressure medications, and not realizing that how fast they can lose fluid through the heat. In that case, you have to be more vigilant, more careful to force yourself to drink more water. But if you have heart problems, a kidney problem, or liver problem, these are 3 general conditions where your body tends to retain fluid. Then again, the formula is look at your legs every day when you're standing up, and if you're having swelling, do a pitting test. If you can pit your legs, make a dimple, then means you have more than enough water. So drink only when you have to. Don't try to force more water. It will just make your medical condition worse. So that was my few points on the water intake. Being a kidney specialist, I have a lot of experience on fluid and electrolytes. So I think that will answer the question for most of the people and my folks. And I think that will do this topic for the day. On that note, we'll see you back next time. Again, folks, God bless you and God bless America. And I'll be back next month with more topic and more information. I hope this will help. Thank you and have a nice day.